Chapter 11, Planning for Children's Health and Safety Education. So it's important that we make sure to participate in training regarding health and safety, since state law requires those that work with children have this information. Otherwise, we'll be liable. If not informed, we could be deemed as negligent. So we need to keep abreast of continual changes that happen in the field, and professionals must stay up to date with these changes. For example, I think there will be changes coming up in regards to CPR training. The California Healthy School Act, HSA, that's the acronym. This law gives parents the right to know what pesticides are being applied at public K-12 schools and at licensed child care centers in California. New changes to the HSA expand the scope of information for parents and aim to minimize pesticide use by educating school staff on the least toxic ways to control pests. And you can find out more information at the website at the bottom of the page. So family involvement in children's health and safety education is fundamental to improving children's well-being. It provides parents with developmental information. It improves parent-school communication, and it's an opportunity to enhance parenting skills. Teachers have many opportunities to address health and safety education throughout a child's daily learning experiences. We can incorporate incidental learning and teachable moments when things happen that relate to health and safety issues, and then we can include it also in the planned curriculum. So the principles of instructional design include select a topic that's developmentally appropriate, that addresses the children's interests and abilities, is respectful to cultural differences, and builds on the children's understanding currently and their skills currently, and then what would come next, which would be a scaffolding approach, and then is part of a long-range plan. We want to develop learning objectives that guide content selection and organization, identify expected learning outcomes, aid in determining how a topic or theme should be presented, and can be used to evaluate the lesson's effectiveness. And so here's Bloom's taxonomy of learning that we've seen before previously in previous PowerPoints. Since we can't directly measure learning, we can categorize learning and then use measurable objectives to determine learning. And so there are 6 levels of learning, the lowest level being remembering and the highest being creating. And then under each of those columns, again, are objectives that we can measure in each of these levels to determine if learning has occurred. So consider and select the content and presentation methods that appeal to and hold on to children's interests and attention. Focus on only one basic concept at a time. Make sure that you're appropriate in the length of time based on the children's attention span. Use the children's senses. Use real objects or 3-dimensional depictions, not 2-dimensional pictures or flashcards. And balance out child-initiated and teacher-directed. You set up the materials and facilitate and support the child's play. So then you want to evaluate the learning experiences based on learning objectives you've developed through the use of Bloom's taxonomy, and how could this experience be expanded and built on? Because we want to make sure that we repeat and then build on learning.